Hospitals across the state are seeing more and more COVID patients. UAB told us today they set yet another record of caring for 92 COVID patients. Tennessee is also being hit hard. Doctors there have a powerful warning to anyone doubting how dangerous COVID-19 can be. Stacey Case has more.
The same critical care doctors who first called for a statewide shutdown in the spring now say Governor Lee isn't doing enough to stop the spread of COVID-19.
Their lungs have literally turned to stone. And for the first time in 35 years as a clinician, I feel totally powerless in the ICU.
They joined this Zoom conference reporting coronavirus hospitalizations soared by 70% and hospital bed use increased 56% in June.
For so many people that I come in contact with, will say, well, I know the virus is out there, but I don't really think it's worse than the flu. I don't think it's as big a deal as people make it. I don't really believe in all of that. And it's this message that's getting sent by many of our leaders that gives people the idea that it's really not that bad.
They're asking for 3 specific things. Number 1, a statewide mask mandate.
When people refuse to wear masks, it does not protect their liberty. This selfishness is a threat to the liberty of everyone else.
We wear seatbelts. We practice safe sex during the HIV epidemic. And now we can't wear masks.
And they say jail time is not off the table.
What kind of penalties do you think would work to encourage more mask wearing, and who would enforce it?
And I think the practical way would be to hand out citations and fines to people. And if you have maybe more than 3, then maybe you do think about someone having to have some time in jail.
Number 2, they want the state to require employers have safety measures in place and enact penalties. And 3, they say the governor's executive order to give authority to county mayors to issue mask mandates leaves city mayors out in the cold.
Asking for this.
I called the governor's office.
So I wanted to call and see if the governor had any response or any intentions of doing that.
I did not hear back from the governor's office by news time, but these doctors are determined to be heard.
I've not seen anything like this in the 20 years that I've been doing critical care.